Good afternoon, everybody. After a heavy post-lunch session, Dr. Sanivas, Cyclop team, and SNEND Hospital, Dr. Pradeep, everybody gave me this opportunity to talk on diet. So nothing is special, but what actually I'm following in my clinics, even if it is vestibular or non-vestibular, I'm just trying to change their lifestyle and the diet. Sometimes I have seen that its effective is more in to their lifestyle, and also they are helping me and they are telling, sir, whatever the diet you have given to me, it is working. Actually, it's working, and I'm getting cure of my dizziness and vertigo. Okay, so as we know that our body, organ, tissue, and cell all need nutrition to stay healthy, as we know. And diet plays a major role in presentation and cure of wide range of disease and health problem. And nutrition is a combination of process of receiving and utilizing materials needed for sustained life. But all the diet, whatever you are taking, it's a wrong diet or a healthy diet, whatever, it's running through a process that is digestion, absorption, assimilation of nutrient plus elimination of waste products. If all processes are running successfully, we are staying healthy. If anything is going to wrong, then you are unhealthy or your digestive system is not working functionally. So you will facing some problem. So inadequate nutrition, unhealthy diet, and wrong lifestyle create more toxemia due to improper digestion that you know. So dizzy spells and vertigo occur due to many factors, but this may be one of the factors. Common food groups of a typical Indian diet and cereal, millets, pulses, fruits, vegetables, nuts, oil seeds, fats, and oils. We all Indians are using all these diets frequently, and if you'll see, food is always needed for everybody, and we are maintaining our different meal plans. Now everybody are busy with their lifestyle, with their job, their working business or something like that. So they are skipping their breakfast, they are not doing regularly lunch or doing heavy lunch, heavy dinner, whatever the things. Due to that wrong lifestyle, they are facing problem in their, they are damaging actually their immune system. So if you see a Indian diet, people are thinking, I've gone through all the literatures, some literature saying Asian diets or Indian diets are more heavy. And if you'll see, in our country, where we had access to some most nutrients food in the world, every country or state or region will have its own diet that is local or healthy for the people that live there. Example, that is called Meditannancous diet, according to the region. Suppose I am from Odisha, our food is different. Some people are from North India, their food is different. Some South, their food are different. But if I have seen in Ayurveda books, they are telling like where you are going. If you are going to any region, try to maintain that, taking that food and to be stay healthy, because that diet decided by their ancestors on their climate, on their part of choice or interest. So due to that, you have to eat that kind of diet according to the region. So what we are doing wrong? If you see the wrong diet or lifestyle, actually what we are doing like this. We are not taking breakfast. Wake up not early in morning. We are actually skipping our breakfast. We are taking lunch, breakfast at 10, 11. Or sometimes we are skipping that also. And 2 to 3 we are taking heavy lunch. Then after a long gap we are taking dinner with all good restaurants, chickens, non-veg, veg, everything we are taking as a good dinner, heavy dinner. But actually what should we follow? We should follow like this. 7 to 8, good breakfast. 12 to 1 good lunch. Then again you have to reduce it in snacks time. Again in dinner, it will be very mild diet. So what is faulty lifestyle? As I told, skipping breakfast, high intake of glycemic index foods, consuming carbonated drinks, alcohol, no gap between food and bedtime, eating too fast or no chewing. So it's create weight gain, changing immune system, gastritis, thyroid imbalance, frustration, and low motivation level. So it's maybe creating some kind of psychosocial problems, or it's creating some kind of disturbances with your lifestyle, and it may create a dizziness. So food to be avoided for Meniere's disease. If you'll see in the literature, all the literature are talking about low salt diet for Meniere's disease, and those foods are triggering for the migraine that should be avoided. But there is no systematical review, any literature that they are showing, okay, these particular diets should be for vestibular system. So I'm not talking something different, but I have concluded all this, collected all the information and making a systematic diet for the vestibular patients, and the people are following that. So I'm thinking it may be a good help for the vestibular patients. So if you'll see what to avoid in Meniere's disease: high salt diet, processed and canned food, salted crackers and chips, baked food with salt and baking soda, ketchup, sauce, soya sauce, Ajinomoto, that is China salt used in Chinese cooking, high caloric food, fatty food, sweets, desserts, and refined oil. What food triggers in migraine? In morning sessions, nicely discussed the migraine, about the terminologies and everything. This is the new recent books I got from LA 2017. In that they have mentioned vertiginous migraine is the best terminology to define the migraine. So this is the common misconception that we are thinking that particular food is so sensitive to trigger the migraine, and we should, the person who has a vertiginous migraine, they should to find out what is the triggering factor. But sometimes it's very difficult, because the patient doesn't know which kind of food is triggering that migraine. So many food triggers may not be potent enough to cause migraine, but may increase individual's migraine threshold modestly for a days. Some additional list of foods that trigger migraines: as you know, wines, heavy alcohol drinks, aged cheese, fresh baked bread, frozen yogurt, banana and peanuts. I have written here unknown cause, because I have seen that in 32 patients, we are referring patients for the screening test of food allergy test, and in that we have seen banana and peanuts are an allergy condition for the migraine patients. As in morning sessions are told, tendons are told, like banana is a good nutrient for the nutrition for the vertiginous migraine patient. So that's why it does not, I don't know, like this is particularly why the banana is an allergy condition for the migraine patient, I don't know. So that's why I've kept it unknown cause. Then buttermilk, hot dogs, then iced tea, cola, low caloric foods, low fat foods, pizza, restaurant food, Chinese food, caffeine, chocolates, pigs, onion, orange, papaya, pickles, and tea. So these things are, I have seen that in different children and adults. So in children, I have seen orange, papaya, and tomato, not banana, but in adults, I have seen that banana and peanuts. So if you see the management of vertiginous migraine, after 36 hours of attack, the patient should look back to the triggers. Actually, you have to take the detailed case history, spend some time with the patients, tell them, write a diary of your 2 days to 3 days lifestyle and diet plan. From that, you will see what kinds of food they have taken and why they are facing some kind of problem. You can ask, okay, particular this food when you are taking, you are facing some problem. Then they are saying, yes, sir, I'm facing a problem if I'm taking this food. So you can put it as a triggering factor, but it's a query mark. Then you have to search it once a while also. Was it environmental, physiologic, or dietary? Careful observation is required. Sometimes the patient's strongest trigger are not dietary. So lifestyle modification to avoid stress, fatigue, dehydration, or hunger are employed to avoid symptoms. So 10 successful tips what I am following actually. The first session I am doing, creating awareness about the problem, why the patient is facing problem. Then no excuse, complaint and blame. Patients are telling, no, I have a lot of business, I don't have time, my family is not supportive, they are not giving proper foods. So no blame, no excuse for that. You have to be, if you are trying to be cured, so please be careful for that, for your health. No shortcut way. It is 1 day, 2 days, it will not happen. It will take 3 to 4 months to change your lifestyle, bad lifestyles and wrong lifestyle. So need motivation for changing, and it should be a mindset. If the patient is ready to accept, then it will be okay. Dedication is required. Attitude, chew the food 20 times. It's, I saw a YouTube video by Sandeep Maheshwari, motivational speaker. He's told to all, every Indians, those who have fat body, to chew food at least 20 times. So I am also telling my patients to chew foods 20 times. Eat water and drink your food. That strategy is like that. Eat in a relaxed manner. People are watching TV, talking with the phone, and they are eating very fast. That is not actually the proper manner. Eat in a relaxed manner. You have to sit properly, and you have to eat slowly. Take some time at least. Don't sleep after food. People have some bad concept that after taking food, if you will take some rest, then your age will increase. It's not like that. So as we have talking about exercise, that is vestibular rehabilitation therapy, we are giving yogas and meditation to reduce their stress, lifestyle, stress and anxiety levels. And same time, diet and lifestyle change also helps to a lot. And superb diet plan brought changes in life in 6 weeks, what we are following. So anti-inflammatory food, as you know, olive oils, 2 spoons salad, once in a day. Tomatoes, because it's giving more potassium. Then nuts, Brazilian nuts, and ginger. It's because due to nausea. An appropriate diet, what are following, like almonds and watermelon seed plus milk, amla, coriander leaves juice, fresh fruit, fresh vegetable, intake more water, ginger plus water, extract of ginkgo biloba, herbs, as you know, it's very old things, lemon, black pepper, vitamin and herbal nutrition, diet supplements, people are taking vitamin B, zinc, magnesium, ginkgo products, and ginger root. We are following this, actually giving all the patients in a systematic way. 12 calories Indian diet sample plan, that is early morning 7 a.m., a glass of lukewarm water, lemon and cup of skipped milk or 2 biscuits. Morning 8 a.m., 2 white rotis or chapatis, upma, idli, whatever the reason wise. Mid-morning 10:30s, fruit salad without salt, 50 calories. Lunch 1 time, 1 cup rice, 1 cup mixed vegetable salad, small bowl of raita. If people are non-veg, then according to we are modifying that non-veg items also. Afternoon 4 p.m., buttermilk, protein shake, 1 glass. Evening 6 p.m., small snacks if they are feeling hungry, otherwise skip it. Then dinner 8 to 9, 2 rotis or chapatis, 1 curry and 1 big bowl salad. So if you are following all these diets plan for a couple of months, 3 months, most probably that after 1.5 months, 6 weeks, I have seen that again when I'm calling for the patient for a follow-up, then telling, sir, we are okay, now we are maintaining our lifestyle, so don't worry, now we are like not feeling dizzy. But earlier they have a lot of stress, tension and everything. So simultaneously I'm giving also vestibular rehabilitation therapy and cognitive behavioral therapy. So some people are getting cured from that. From conclusion, the food won't miraculously cure vertigo, dizziness or a vestibular migraine, but over time it will bring relief. So the frequency and the severity of attacks will subside and will an adequate medical support, proper diet and nutrition. So everything is required. You have to take medicines, proper diet plan, yoga, exercises, and also your vestibular rehabilitation therapy. Healthy eating is one of the most powerful tools that can help you fight with vertigo, dizziness, Meniere's disease, and vestibular migraine. So be patient and be consistent, and results will automatically, it will show. Okay. So when you are giving any diet plan to the patients, tell them, just don't follow this diet tomorrow onwards. What actually I am following, I am just trying to modify little bit of their area of interest. Suppose one person is taking alcohol daily, so I am trying to change at least, okay, weekly thrice, then weekly once, then at least in month. So in this way, you have to counsel a lot, because if you give the diet plan with a writing, people will not do it, because as you know, diabetic patients are also there. People, endocrinologists are giving diet plans. People are following for a few days. After that, they are forgetting. So every time you have to tell and give a written diet plan and try to change the diet plan according to their area of interest. If they are taking interest to take that food, then it's okay. If they are not taking that interest of food, you can't change. So you have to modify that diet. So definitely they will help you. And I have seen that people are very cooperative. Sometimes if you will counsel, if you will take some time with them, sit with them, discuss with them. And last things, you have to create lot of awareness about why they are facing that kind of problem. So this is the main motto of my presentation. So please try to guide some diet plan for your dizziness patients and vertigo patients. Thank you so much.